We do have Dr. Faith Brebner and, of course, Minister, Secretary of Health and Social Development. Yeah, good morning and welcome, ma'am. And, of course, Deputy Chief Sec. Good morning and welcome.
Good morning and thank you for having me.
All right, so there's an increase in foot and mouth disease on the island, and there are some concerns.
Yeah, so what we have is an increase in two diseases that look pretty similar but are somewhat different. We have both hand, foot, and mouth disease, and we have impetigo. So what we've been noticing is that over the last couple of weeks or so, we've been seeing higher rates of these diseases, primarily in children. Let me also start by saying that this is actually a normal thing. Both of these diseases are relatively infectious or they are contagious, meaning it's easy to pass from one person to the other. And we see it in cycles. So every couple of years, you will see, 1 year we'll have more than normal, then we go back and taper off. And this year, we just happen to be probably we're noticing it more. Maybe our surveillance system is a little better, so it's picking it up a little bit better. So that is what you've been seeing, causing quite a number of our schools to shut down for a couple of days because they need to sanitize. And then we've been telling the parents to keep your child at home if you are seeing these diseases. So what do they look like? So impetigo is the one that is basically reddish sores along your face, along your mouth, your nose, and your hands, and so forth. While hand, foot, and mouth disease looks like basically sores around your mouth, but you also include rashes on your hands and your feet. Yeah, so you're seeing it with children, primarily children 5 and under, so those that are in the early years of either preschool or early years of primary school. That is where we're seeing the most cases on the island at this point.
Mm-hmm. All right, so you just outlined the symptoms. Are there, before the rashes and the sores break out, are there earlier indicators or symptoms that can have a parent aware that this could eventually turn out into sores? Speak us about the early indicators of what the symptoms are.
Certainly. So let me step back a little bit. So one, the impetigo is caused by a bacteria, right? So it's a bacteria that gets into you, that's causing you to get ill. The hand, foot, and mouth disease is caused by a virus. So again, the virus gets into you and it's causing you to get ill. Now, I started there because what I am going to say are the symptoms that we normally see whenever you have a bacterial infection or whenever you have a viral infection. So it usually starts with, for example, the fever for both of them, because of course your body, the natural response in your body is to try to ward off this thing that is attacking it. So you get a fever. So the children, you usually see them with a slight fever for the first set of symptoms. Of course, because they are getting a bacterial or a viral infection, they feel ill, they feel irritable, they're just not well. You can tell when a child just not feeling well. For the hand, foot, and mouth disease, you may get a little bit of a sore throat and a loss of appetite. Again, normal because you have an infection that is happening in your body. And of course, for the impetigo, you get, you start then seeing the sores and so forth coming up. So again, because these are common bacteria or common virus that's going around, because this is not something new, because we've been seeing these diseases for many, many years, we just really, really want to highlight that in this year, we are just encouraging you to do a little bit more of the hygienic stuff to prevent it from spreading even more than it's spreading right now.
Okay, good morning again. In terms of the hand, foot, and mouth disease, now, based on what the research is saying, the virus can remain in your body even though the symptoms go away. Tell us a little bit about that because, I mean, parents may want to know how exactly to treat with the situation, especially during a school term.
So, for any viral infection, what usually happens is the virus gets into your body. It goes along a course of making you sick if it is the kind of virus that makes you sick. It goes along the course where there's a period where you are most infectious, and then it tapers off after a while. So that is a normal process for any kind of virus that is in your body. For hand, foot, and mouth, it is really the period where you have the sores, where you have the rash, where you have, when you see sores and you see a rash, it means that you are also seeing a little bit of a pus, a little bit of an ooze, a little bit of that kind of liquidy, quote unquote, thing coming out. Usually, that is the period where we are most infectious, meaning we can pass it on to someone else. So that is the period that you need to be most concerned about. So it's critical to now think about what do you do whenever you see that happening. And that is where the hygiene part comes in that we could talk about.
Okay, and in terms of adults, I mean, I know you said that the younger children are at higher risks, but in terms of the adults, what is the situation? What are the numbers in Tobago at the moment?
So the numbers in Tobago at the moment are very small for adults. And I think it is because of how children interact with each other why we see these diseases in children primarily. My mother, who's a preschool teacher, always says that, children are always dirty kind of thing. Children are always interacting with each other. Children are always playing with each other. They're always touching each other. Even if they just wipe their nose or even if their hands are dirty, they stick their hands into another child's face. That kind of thing. Just the way children interact with each other make them more susceptible to the infections happening versus the way adults don't really interact with each other in that kind of way, in that kind of close knit way. So it seems like right now the biggest issues that we are seeing are in children. Although adults can get sick, the children are the ones that we are seeing with the disease.
All right, treatment, vaccines, are they readily available, or what is the treatment will be prescribed to treat this presence of these three diseases?
So it's the two, impetigo. So again, impetigo, because it's a bacterial infection, what we can do is basically give an antibacterial cream to rub on the spots. That is what is usually used to help with the impetigo. For the hand, foot, and mouth disease, because it's a virus, and because it's a virus that is not, it's not a virus that causes severe harm. It's not a virus that causes, like death and severe disability and that kind of thing. So at this point, there is no, for example, vaccine against it or anything like that. You kind of just have to let it go its course, let it run its course. And once it runs its course and you are fine and you try your best to not infect others, then, the child will be fine and they can go back to school and go back to doing whatever else they were doing before.
All right, so there's no need, I want to be very clear on this. When the parent recognizes that this child has the symptoms being displayed, hand, foot, and mouth with the sores and so on, there are parents who would want to take them to the doctor. What is recommended? Do you take them to the doctor? Do you call a health professional? Because if you bring that child in the public, obviously there are those who are going to run scared. How could you bring a child into the public space? What is recommended for parents who recognize this infection on their children? And obviously the quickest thing to do is to run to the doctor. What is recommended, given that you just outlined that is not a severe disease as the ones that we've had to deal with recently?
Well, once again, there is no fear that there's this horrible infectious disease running around. It is not that to be afraid of. We do encourage you to see a doctor, to call a health professional. Um, Again, because you may not know whether it is the impetigo or the hand, foot, and mouth, so that you know which one to use, because you don't necessarily want to use an antibacterial cream on hand, foot, and mouth disease because it will not work. So we do encourage you to contact your health professional to have them actually see or give you guidance on what to do. The most important thing that we are encouraging people to do, though, are the hygiene things. What do I mean by that? Again, going back, it's a bacteria or a virus. The thing that causes us to be safe against bacteria or viral infections, keeping our hands clean. Soap and water basically washes away the virus, washes away the bacteria. If the child has the sores or has the rash and they have come into contact with clothing, with bed sheets, with stuff like that, ensure that you wash those so that other people don't come into contact with those things. And ensure that the area around, if they have the rash or if they have the sores, ensure that you keep those areas clean. Those are the things that we are really encouraging you to do so that you minimize the possibility of having a spread. And definitely the most critical part is, particularly if it is a child that is in school, in daycare, in wherever, keep that child at home, because you don't want them interacting with other children the way children interact with other children. You don't want them doing that kind of interaction, and you don't want them interacting at school and getting others sick. So the critical thing is, if you're seeing these rash, if you're seeing this sores, if you're seeing this kind of yellowish crusty thing around the mouth and the hands and so forth, keep the children home.
Naturally, you would assume that the schools, well, schools with affected students are being disinfected and that kind of stuff. How serious is it right now in Tobago, and how rigorous the disinfecting and making sure that the school is back to normalcy is right now in Tobago?
So we have been, as in the Division of Health, Wellness and Social Protection, have actually been working very closely with the Division of Education, Research and Technology to ensure that we have all of the protocols correct, to ensure that we have all of the sanitizing that's necessary, to help them to tell the teachers and to tell the parents, this is what you do when it happens, this is what not to do, kind of thing. So we've been working very closely on that, and we've been encouraging the schools, encouraging the teachers and principals, whenever you see this, let the division know, so that, as in let the Division of Education know, so that they can start their, the process for sanitizing. But then, as I said before, the sanitizing that you need to do is not, you're not bringing in any additional chemicals or anything like that. We're doing the traditional kind of soap and water and alcohol kind of interaction. It is that kind of sanitizing that is necessary, because that is what is most effective against the bacteria and or the virus. So we're really just encouraging schools to go back to, when we were talking about in COVID, having people wash their hands, ensuring that if you see someone who looks sick, ensure that you send them back home, call back the parents to come back for the children, do the sanitizing around that kind of where they interacted, and that kind of stuff is what we are encouraging people to do. The fact that we have actually picked up that there is a slight increase is because our surveillance unit at the Division of Health, Wellness and Social Protection have actually been able to pick up the cases that make it to the health centers, that make it out of the schools, because we have a system where you call the surveillance unit and they do the follow-up and that kind of thing. So that is all being done in the background. That is why we know that this is a situation that we need to really just encourage the parents. If your child has these signs and symptoms, please just keep them home, keep them out of the school and daycare system.
And in terms of medicine, if a parent, you're recommending proper hygiene, you're recommending to visit the doctor, but in terms of medicine or medication, are there any recommended medication? I know persons may go the natural route, but feel free to share.
Right. So the medication, as I said before, because the bacteria one is the impetigo, you may use an antibacterial cream to place, around the areas that you see the blisters, that you see the sores, that you see that kind of thing. But for hand, foot, and mouth disease, there isn't really a medication that we can give for that. Of course, parents and people are welcome to provide a soothing medication. You may try to take, maybe the fever grass because the child has a fever and that kind of stuff. But of course, that is just helping to soothe the symptoms that the child has. And we just kind of need to wait for the couple of days for the disease to go its course, and then the child will be fine again within the next couple of days or within the next week or so.
Is there a different, can you distinctly differentiate between chicken pox and hand, foot, and mouth? Are there any resemblance or any other type of disease that affects the skin that we may be confused with? You have measles, you have chicken pox, you have monkeypox. Speak to us about any resemblance at all, or it's just straight?
Right. So again, because all of this is the reason, for example, why you should actually contact a health professional to go to see which one looks like which. Because again, they all come back looking relatively the same. Even the impetigo and the hand, foot, and mouth disease, they look relatively the same. The only difference really is the hand, foot, and mouth disease. You end up with the rash. You end up with the rash on the hands and the feet, and you don't necessarily see that for the impetigo. So because all of these things are around and all of these things are normal, and by the way, we are actually collecting data about chickenpox and some of the other diseases that you were just talking about. But in this case right now, what we are seeing is the increase for the hand, foot, and mouth disease and for the impetigo, and that is why we're kind of focusing on those. But the good thing is, when you do the hygiene things that's required for those diseases, you kind of help with the others, because again, they're either bacterial infections or they are viral infections, and the sanitation is what is critical for all of these kinds of diseases.
Okay. Is there any other issue on these type of diseases that you want to speak to? And can we, I want to give you an opportunity to clear the air on the controversy surrounding your portfolio as Secretary of Health. After you've done covering, can we ask a question for you to get an opportunity to bring further clarity to the controversy surrounding yourself and your office?
I don't know that there's any controversy surrounding myself or my office. I am somebody who speaks my mind. I am somebody who speaks frankly. I am somebody who have honest conversations with the members of my staff and the organization I run. I think I'm doing a very good job at running it. So I don't know that there's any controversy surrounding my office at all for me to even try to address it at this point. And let me jump in and say very quickly that I actually have another interview at 7 a.m. with another media house that I need to jump onto. But there's no controversy at all.
All right. Well, we want to thank you for being with us this morning, and all the best to you. And happy Easter, just in case we don't see each other again.
Oh, thank you. Same to you.
All right, Dr. Faith Brebner there, and of course, Secretary of Health. And hand, foot, and mouth is real, people. It's out there, and according to cases are being increased or increased. And so the advice is keep your children at home, practice proper hygiene, wash your hands, keep yourself tidy as much as you can, sanitize, and so on. Some cases, children, young children, you have to be monitoring them to keep their hands clean with sanitizers that are sensitive for children's skin. There are some sanitizers that can harm, depending on how sensitive or how young the child is, and so on. So that's good.
Yeah, and the thing is, and one of the more important things she mentioned is the fact that children interact different from adults, and play right through. And because of that, you could put yourself at risk, especially if the person is suffering with one of these situations that we are seeing in Tobago right now. I see one of our loyal viewers is saying, I'm at loss about the hysteria about hand, foot, and mouth, and impetigo in